Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Dr. Tasha Michaels, Vice President of Clinical Operations at Sona Pharmacy Clinic. Thank you so much for joining us, Tasha.
Yeah, thank you so much. I'm excited to be here today.
Well, as we think about your time and our listeners' time, I'd like to just dive in a little bit on you sharing about your background and a little bit about Sona and how Sona helps our aging population.
Yes, so I'm a pharmacist, as you said, and I have actually been in the community pharmacy area for quite some time. I graduated from pharmacy school and then did a community pharmacy residency at UNC, and then I have been lucky to be at Sona for the last 10 years and almost 2 decades of being a pharmacist, which is crazy to say. At Sona, we have a program called Sona Access, which is really created with our aging population in mind. Although it's for anyone, it has adherence packaging that allows patients to be able to take their medications and stay on that path that they should be with their medications. So they get 4 packs at a time. There are morning, noon, evening, and bedtime slots, and all the medications go in those slots. So then whenever they wake up in the morning, they just pop out all their morning medications, and they're able to take them at one time, which makes it a lot easier for people. And like I said, it can be for people who have complex regimens or just need a little help making sure that they take it appropriately. This program does have a fee associated with it, and you can see more information about the program called Sona Access on our website at sonapharmacy.com and go to the medication support tab. So that's one of the programs we have. Another one is just medication synchronization, which means that we fill all of the patient's medications one time a month, and we have them ready for pickup, or we offer complimentary delivery 45 minutes from our pharmacies. So that's really how we help the community in that aspect.
You know, as you think about the naming around access, I think that's really powerful because so much of what Four Seasons does is about making care accessible wherever one calls home. And so it's important that people feel like they have access to their medications if that's something that's needed for them wherever they call home. And so thank you for sharing that. Oftentimes I realize that whether it's the patient or their caregiver, there's stress associated with how do I make sure I have what I need when I need it? And so you certainly shared about that. Many caregivers understand that keeping track of medications and making sure they're administered correctly is a huge undertaking. What are some of the issues that may arise in terms of access and safety? And you talked about a way that you're already working with that, but feel free to expand a little further.
Yeah. So what I think about is that there's not just a primary care physician involved anymore. There's primary care, there's specialists, there's all these different people. And luckily, most patients, except for maybe specialty medications, use one pharmacy. So we're kind of like that safety net to see all the pieces of what's happening. And that actually happened with a patient we had last week. We were looking at their medication regimen going, hey, it's time to fill your blood pressure medicine. But wait, you have 3 different ones on here that are all from the same class. 2 of them are from cardiology. One's a little older, a couple of months ago, and one from primary care. Like, which one is the most recent one that you're supposed to be taking? You know, I can look at dates written to make an educated guess, but without calling someone to verify, you know, do you know? And the patient was like, I'm not sure which one I'm supposed to be on right now. So reaching out to cardiology to say, hey, which one is these is the correct one that you should be taking, and then notifying primary care that this is the right one, and to get everybody's medication list, including our medication list, up to date so we don't have issues like that. So a lot of times it can just be changes in therapy. It can be changes in doses. Sometimes, especially when a medication is stopped, the doctor may say, hey, stop taking X medication, but they don't send us a notice that says they stopped taking this medication. And a lot of pharmacies now do a lot of auto refill. And so it just continually gets filled and filled and filled. And so that's why, as a caregiver, patient in general, making sure your pharmacy knows those medication changes is really important. another thing that's just weird about pharmacy, not weird about pharmacy, but I say weird about healthcare, is prior authorizations. Prior authorizations often come up whenever a patient's being prescribed a brand name medication, but now also with pain medications. And so basically what that means is that the insurance needs more information from your doctor about why they're prescribing this medication. And once the insurance receives all that information, they have 72 business hours to make a determination whether they're going to approve it or deny it. And the doctor's office definitely gets followed up on of what happened, right? And sometimes the patients do, but the pharmacy is sometimes missed in that loop. So if a patient does get an approval or their doctor said, hey, that medication's approved, make sure you call your pharmacy and let them know so that they can fill that medication for you, because they may not have received that information either from the doctor's office or the insurance company. So those are just some other things about access and safety and how it kind of all works together, because if you need that new diabetes medication and it required a prior authorization, you're not going to start it, and we may not know to fill it when it got approved. So
one of the things that I like so much about what you're just talking about is another key phrase or a key term around partnership. And at Four Seasons, we're focused on providing access to care where everyone calls home and partnering with their family, partnering with their other providers, partnering with those that are important to them or a part of their care team. And you just explained how you and Sona partner with your patients when they have a need around medications. And I love some of those safe practices that you recommended. Could you share a little bit more about how your team collaborates with our teams to ensure safe access to medication?
Absolutely. So with the Sona team and the Four Seasons team, we work a lot within hospice and palliative care. So we're always looking at, is it the right dose? Is it the correct route? Does, the directions make sense? All of those kind of things. But what's been happening that I feel like a lot of people have been running into a lot lately is back orders. Mm-hmm. So there are several medications that have been back ordered. And over the last couple of years, it just continually keeps just hopping and changing from one medication to another. The reason for the back orders are varied. It can be, manufacturing delays. It could be that there used to be 10 generic manufacturers of this one medication, and now they've gone down to 4. And they just haven't ramped up production enough to keep up with demand. So we communicate back and forth quite often of, hey, we got this medication. Guess what? The tablets are on back order, but I have capsules. Are you okay if I change it? Or can we change it to this? Maybe it's changing to an immediate release version versus an extended release, if that makes sense. And so that's how we kind of partner together on those things. I think about on Friday, I actually was talking to a palliative care nurse practitioner for Four Seasons about one of the patients, and the medication was approved or was the preferred medication for the insurance. However, the dose that they needed was much higher, and it didn't come in that milligrams. And so, like anyone, you do the math and you go, okay, well, 3 of these capsules and that gets us there. But the insurance didn't want to pay for it that way. So we had to divide it up between, a lower dose and a higher dose to get to the maximum amount that the patient needed, or get to the amount the patient needed, and make sure that the directions were very clear to take, capsule A with capsule B to get your total dose for that appointment or that dose. So just working together in those kind of aspects, and them knowing one side of it, the patient side, but us knowing the insurance and what's available side.
We've talked about access and partnering, and as you just talked again, it made me think of another key term that we like to assure our community is an advocate. We are an advocate for them to have the very best care wherever they call home. And certainly you just gave that as an example of you were advocating for that patient to have what they need when they need it in a reasonable and a safe manner. And I really appreciate that. We're so appreciative of the collaboration that we have to provide access to care, and the medications as part of that throughout all of Western North Carolina, and a way that you yourself serve as well as others is as an advocate. And so I wonder if you'd be willing to share just a little bit further about whether it's as a pharmacist, whether it's as a leader, or whether it's as a board member, of just how do you advocate and how do you care?
I think it's a little bit of all of them, actually. I love helping people figure out what their needs are in healthcare, because they may not know all the pieces, but they know what they are trying to get to. And because of my background and experience between community pharmacy, ambulatory care, long-term care pharmacy, and dispensing medications for hospice and palliative care, that I've been able to see a lot of those pieces, even the insurance side of things, which we call managed care, and being able to help people figure out those steps forward to be able to get what they are actually trying to get. And they always need an advocate, because they don't exactly know what the steps are that they need to take, but they know they need to do something, but they don't know where to start. And so at least starting them on the right path can get them to the right destination.
I love what you were also just saying, because it made me think about the relationship that Sona has with those that get their medications filled. It's a collaborative relationship where the patient is not just a number. The patient is a person with a story. And that's the exact same as it is with Four Seasons. Because with Four Seasons, we realize that every single moment is so important and crucial to those that we're honored to serve. And so it's important that we take time with our collaborative partners like yourself that says, hey, we genuinely care about you. And so the way that we serve each of our patients may look a little different because we're co-creating. And I appreciate how you focus today on the importance of safe access. But I think that you've also expanded it for those listeners to say, hey, I want a partner for my medication, like what Tasha was sharing today. And hey, if I need hospice, palliative, home care navigation, I want to have someone who's going to partner with me. And so just encourage our listeners to reach out to us if something they've heard today has been of interest, whether it's for yourself or for a loved one. And just know that a phone call is all it takes to find out if we can provide additional care and support. And so when we think about care and support, could you share a little bit about your role with Four Seasons as a board member?
Yes. So I am on the board. I actually chose to be on the board because I wanted to give back to the community. It also fit my, pharmacist hat of excited about being able to use my knowledge and bring that into the Four Seasons realm, as well as the mission and vision of Four Seasons is very near and dear to my heart, just because my papa, whenever in his last days, he had hospice at home. And just saw the benefits of that, being able to take some of the pressure off the family and the friends. My papa also had dementia at that point, so being able to stay in his home and not be in a new environment was very important to us. It allowed us to know that his care was taken care of, and family and friends could come and visit and just be more at peace with the process, right? And there are so many services that Four Seasons offers that people are not aware of. I actually ran into a patient last week. There was a lot of stuff that happened last week, as you can tell, because all of these things did happen. It was a busy week. But she recently lost a family member about a month ago and was, navigating that process, and someone referred her to Four Seasons for grief counseling. And she had already had that appointment, and she was telling me how that helped set her on her new path of moving forward. And so she was just so thankful. She didn't even know that was a possibility. And so I think that's what's really important, is sharing all of those and connecting people and those stories to all the services that are provided.
Thank you so much for sharing that. It just reconnects for me why it matters that people have access to trusted partners of care throughout all of Western North Carolina. And it really is an honor that we're able to join with many community partners like yourself to say, hey, we genuinely care. Let us help lighten the burden and provide that quality care wherever one calls home. So to our listeners, thank you for listening. If you have questions, feel free to go to our website at fourseasonscare.org. Tasha, is there anything else that you would like to say?
Just thank y'all for having me. I enjoyed being here today.
Thank you so much. We appreciate it.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.